Hi guys, Matt the Osteo here. Today we're going to go through some simple neck stretches. Before we get into that, I'm just going to go through a quick medical disclaimer. So the neck is a very complicated structure, okay? And so what I'd like you to do before going through these exercises is go and see your osteopath, chiropractor, physio, GP, if you're suffering with a lot of neck pain or continued stiffness, which is going on for long periods of time, okay? Or especially if you've got any pain going down the spine itself or into the arms with any pins and needles or nerve-related pain, okay? Just so it's nice and safe to do the exercises, okay? So I just want to quickly go through some of the things that can go wrong in the neck, some of the simple more common things, okay? So firstly is just a neck strain, okay? So you've got a kind of a group of muscles going through the front here, it's called the scalenes. Through the back here, you've got the kind of what's called the cervical, rectus spinae, collectively, as well as trapezius, rectus scapulae, amongst others, okay? And so when they get tight, stressed, either from exercising or from holding postures all day, sitting in poor positions, even sitting in a good position for long periods, puts lots of stress through these tissues, okay? And then over a period of time, the structures can then complain because they're not used to that, activity, or they've just been doing that activity for too long, and have then become tired and weak as a result of it, okay? So the other issue is, the other more common issue is where the joints in the cervical spine become irritated, either through compression or if they've been stretched, opened. Usually, the more common variant of this is either kind of sleeping funny, where you've kind of either compressed one side or stretched one side from poor pillow choices, really. Okay. And finally, the other one, and the more serious one, is kind of a disc injury in the neck. Okay. This can happen from either kind of too much weight through there, so doing kind of a shoulder press through here, or going through an extreme movement. Okay, such as a car crash or whiplash type of injury. Okay. And so with any of these, if you're suspicious of any of them, I'd rather you get them checked out before doing these exercises. Okay, just to make sure that it's safe and you know what you're dealing with. Okay, so onto the exercises. So first of all, we're going to bring our chin to our chest, nice and slow, and just go to the point where you feel some tension, but not so much of the pain. Okay, so come all the way down, and then come all the way back to neutral. And then we're going to go up, so go as far as you like, and come back down. Okay, and just stop at any point where you're feeling any pain coming on. Okay, and then look to the right, back to neutral, and then back over to the other side. Okay, and then finally, bring the ear to the shoulder. Try and keep your shoulders level through this. And you'll feel the stretch through here, or tightness in here, okay? And then over to the other side. Good. Okay. So they're the more simpler ones. The other one that I'd just like to add to that is if you just use kind of a small kind of tea towel or a small washing towel, and put it around your neck like this. And just hold at the ends through here, okay? And so what we're going to do is this is going to help encourage to take our rotation just a little bit further, okay? Just by kind of passively encouraging it using the towel, okay? So if we're going to look over to the right, so pull on your left hand, keep this one fairly stable, and just encourage your movement just a little bit further. Just because you're kind of assisting these tissues round, essentially, okay? So go all the way over there. Okay, just stop at the barrier. If you feel any pain before that, then just stop at that point, okay? And then come back. And then with the other side, looking over to the left, we're pulling with this right hand and just stabilizing with this left one. And going around. Okay, good. And then you can also, with the other movements, you can just very, very gently, you're just encouraging just a little bit more movement, especially if you're just feeling kind of a stretch on the opposite side to which you're moving. In most cases, it's going to be just kind of a stretch through there, especially if you feel it in a long along the muscles through here. So what you can do is just very gently, just slightly just pull down a bit more, and you'll just increase that stretch a bit more. Okay, and the same with the other side. Okay, and then same with coming down as well. So just again, I'm just using just the weight of my hands, just to push down, and just adding an extra 2 or 3% of pressure through the head, just to take those tissues just a little bit extra. Take that nice and easy, okay, with that extra pressure, especially with the hands. The towel's relatively relaxed, but again, just go to that barrier and stop, and don't stop if you're feeling pain. Okay. So thanks for joining me today. I hope you liked this video. If you did, give it a like. If you're enjoying these videos, please consider subscribing. Okay. I look forward to seeing you soon.